And I'll invite anyone who's turned their camera off to feel free to turn it on, just so we are building community here as we go with the Q&A. Karen, are you available to ask your question and add any details?
Hi. Can you hear me?
Yep.
Okay. Hi, my name is Karen, and I have a 3-year-old. We've done feeding therapy from like 9 months to 18 months in the pandemic, and things are getting improved. And now he just doesn't eat anywhere besides our house, and he does have a hard time chewing food, so he spits a lot out. And we're having a hard time because I bring him places to be evaluated or to do feeding therapy, and they can't evaluate him because he won't even touch the food. So I was just wondering, for you guys, we haven't brought him to you guys. What do you do in that, or do you just have to, as a parent, figure it out how to? Do you know what I'm saying?
I do. I think for some of those kids, and I hear you saying, he won't even touch the food when he's out. If it's that repeated exposure. So I have a little girl I just started seeing, and again, I made this fabulous sandbox. I ground up the graham crackers and it looked like sand, and we put puffs in for starfish, and we had a little spoon for a scoop. She wanted nothing to do with it. That repeated exposure, or just putting things on her tray, her comfort level with me over subsequent weeks, it was really interesting to see that progression. I think it's just repeated, the trust, the comfort, and the repeated exposure. So for those first few visits, they might not do anything, but I think it's just that perseverance. Kate?
Okay.
I have 2 things to add to that. I feel like for an eval, first off, I think Susan and I recognize when we visit with families in our clinic, it is truly a Kodak snapshot. And so one of the questions we always ask is this consistent to what you see at home? And we really rely on our families to tell us, no, this is not what I see, or this is what I'm seeing, because you guys are the best historians for your children. And so we totally appreciate the input and the perspective you bring through your report, and how that can change and direct the course of treatment. I also think the one nice thing that we've seen, I agree with Susan 100%, I think feeding can be a scary thing for some children. And so it is about building relationship and trust. We've also had a beautiful experience using telehealth in our practice. And so telehealth is it's a new way to practice for some, but it's a wonderful way that we actually get a vantage point and have the ability to sit in your kitchen.
Okay.
And so it's nice because that's where children feel most comfortable. That's where we get to see kind of what's in your refrigerator and how the mealtime plays out and where they sit and how their dishes are set at the table. And so we can actually see them in their own space. And for a lot of times for therapy, it can be even a combination, and finding the right provider that both you and your child feel comfortable with. And then if it has to be either in clinic or potentially a blend of therapies between virtual and direct.
Okay.
Does that help?
That really helpful. Do you mind? I know there's other. Can I ask one more quick question? So I think it's more, what do you do in the meantime? Like if you have a child like mine, I think it's almost like he's become embarrassed of him having to spit out food. He's 3, so he can't tell me that. But he won't eat at school. He literally won't eat anywhere but our table or in our house. So when you send them to school, are there any things that the school could do to help? Because he's just very hungry, so do you know what I mean? Like if you have any tips of just how, until we get to the point where, because it takes time, therapy always takes time.
Do you notice, is he more successful with one texture or type of food than another?
He is, yeah, like veggie sticks, cereal. And I've even bribed him with like a cookie, foods he doesn't get ever, like, you know, that's a real treat, and he just won't anywhere.
So even those preferred foods
Yeah.
that he's able to manage well.
Karen, can I ask you something? This is Dr. Mussolino. Does he drinks without problem, with pleasure, from a straw, from a sippy cup? How does he take fluids?
Yes, he does. He takes it through like a water bottle. You know, like he just drinks it, and or a straw cup for
Straw
milk.
cup,
And
okay.
he also will not drink at school.
Oh.
Because I have thought like just bringing smoothies or something.
That was gonna be
like that.
another idea to decrease the behavior associated with being hungry. That you could do some things that he could take and just in liquid form. But it sounds like he doesn't also welcome that when he's outside the house. Is that correct?
That is correct. Yeah.
Okay. And have you tried to just play with food, leave it in the table or the floor, whatever he is playing with other things for him to start
yeah.
experiencing food, not in the setting of trying to eat it?
Yes, that's what we have been doing. I used to bring him to Boston Children's Hospital, and he was doing nothing. And then we have a local speech pathologist who's very close, and we're just trying to get him to touch the food at this point. It's been 2 months, and he won't even go near it. He just literally now pretends he's sleeping. So he.
And this is at home or during the therapy sessions?
It's in the therapy session, so maybe I could try like some telehealth. I didn't even.
Yeah, and also like the one thing that Susan was trying to emphasize is because of the effort that you're trying to do to feed your child so it doesn't have a problem of nutrition, they end up associating your also frustration and stress of knowing that this is going to be really important and at the same time very challenging, maybe dissociating food from the meal time completely at home, not in a session with the therapist, and having all kinds of things that you can think of that you feel comfortable having to also put in the trash. Okay, this is to everybody a personal choice, but allowing him to have it in a context that it doesn't, you're not expecting him to eat it. Okay, so I'm throwing another possibility of experiencing food, but not by having to put it in the mouth. And I have experience with particularly a 4-year-old right now, where we made a ton of progress playing with bananas in all kinds of settings that never ended up being eaten. And then, but it enabled that different sensory kind of experience for himself, discovery kind of phase, to then start saying, okay, I'm gonna take it to my mama. And then he's now eating banana. But it's been a year of working with a lot of different things, and a lot of it in the floor, not in the eating table. And not to say that there is not a meal time, but to say that experiencing food for someone that has such a difficulty may be good to start with not being in a therapy session and not being in a meal moment when you have to accomplish an objective also of feeding your child. And that way, maybe when the food appears in a different setting that is not mealtime, which may be school, how he perceives because of all the environment haven't changed, it may have another entry point. I don't know, Susan and Kate, probably you guys have millions of other ideas.
That's fabulous advice.
Yeah, just make food really toys. That's what I'm proposing here. And if he's into getting things from the kitchen, for example, and will bring stuff that has different textures, watch his, whatever he's gonna put in the mouth if there is a choking hazard, but hard, soft, little, big, let him mix it, put some liquid, let him get dirty. That may be a way that he starts experiencing food in a different way.
This is really perfect. Thank you so much. We'll try that.
We were doing food play in a big bin twice a week at home. And we moved some of my son's toys into it that didn't have moving parts, which made it way more fun for him, because if we put Cool Whip in, it could be snow. If we put graham crackers in, it was sand. And he really liked that.
And the storytelling part, Tricia, I remember you should share too, like how this the storytelling. There is a very important 6-month journey of how to talk about food that Tricia, you could maybe share. I thought it was very instructive to me. I'm not an expert in this, and I was like, wow, that's clever. That may work.
Will is using a social story, which we go through every night, and that tells him he knows the routine, which is really important for him. And we do that with tasting time, and it gives him all the choices, but he knows what's coming next. But with the playing, we didn't expect him to eat any food at feeding team for a long time. And we don't expect him to eat it when we play with food now. Sometimes he does, and that's a bonus. But we just put out random stuff, and that usually goes pretty well as long as we add some choice to it, which is what our therapist suggested, because he was initially not excited.
Tricia, I
thing I think-
wonder if you could share a little bit about the process of writing the social story, who was involved in that, and how it's changed over time.
So I'm sorry, I moved because so now I'm all backlit. So the social story was written by the OT and the child psychologist, and it literally says it's tasting time. Now I sit at the table, and then I'm going to choose which foods I would like to eat. I will have a fun visitor food on my plate that I will pick. If I can't pick, mom or dad will pick. And then it says, today I am going to blank blank, and he gets to choose the 2 things he's going to do. So he picks the food, and then he chooses from the 2 options, which could be touch and smell. It could be lick and bite. And I adjust those choices depending on what the food is and how we've been doing with it. And then he rolls a die to see how many times he's going to do it, so that it's a game for him. And it's a 12-sided die, so he could do everything up to 12 times. And after that, it says, if I do a good job, I get to put a smile on my chart. Everyone will be so proud of me for tasting a new food. And once he got really good at that, they added in a second part to the story, which was for special food. And that said, after I'm done with tasting time, I will choose a special food to eat with dinner, and to have with dinner. I'm sorry, Will. He, I'm being corrected over here. And he would roll a die 6 times, and he would take bites of the special food. And the special food would be, please wait, Will, I'm talking again. I have to pee. Okay, good. Really sorry. And for the special food, he would then choose from the tasting time food that he had, or a food that I knew he could take bites of. And he could pick either one, and then he would roll the die and take up to 6 bites of that food with his dinner. But he recently eliminated that all on his own. Now he just calls it his new food with dinner, and he chooses from a food that I know he can take bites of, that he's not regularly eating, and his tasting time food, and he just eats it with dinner. He doesn't roll the die. He doesn't want the story. He says it's just his new food with dinner. And I love that he did that on his own. That was a huge step.
Yeah, that's great.
Yeah, that's great. Thank you so much. This is really helpful. So thank you. That's a great way to do it.
You know, in addition to spinners, sometimes I make cards based on the kids' interest. You know, so if they like Minions, I'm not sure if you can see it, we have our Minion bite cards, and I put them in a bag, and we put different numbers on them. And these you can control, because you can put all 1s and 2s if they're just introducing to a bag, and put it in your little bag, and they pick it, and they have to do that many interactions. It doesn't have to be a bite. You know, once they get really good at it, you can put lots of 5s and 6s. And so you can really tailor it to whatever their current interest is. Is it Paw Patrol? Is it, you know, Minions? Is it dragons and dinosaurs? So that makes it personalized as well, and the kids seem to like that.
Susan, you said you might be able to do some show and tell with your special camera. I don't
Sure, I have
see a lot of questions.
Crayon. So I showed you some of the things I like to use. see that. You know, so I do have my different bites. You know, one kid loved How to Train Your Dragon, and he was old enough that if there was a blank, he got to pick. If he picked a blank, he got to decide how many bites he did that time, you know, versus having the number in there. Again, not necessarily bites. And as you know, Tricia used, we have our different things. So each session we can decide which ones we're going to put on there so that the kids can't say, well, I'm just going to smell today. Well, smelling's not an option. You know, what are we going to do? So we have those different things. For some kids, I have, you know, our little princess bites. So if we're going to do 5, after they take a bite, they get to take off the princess, or they get to put on the princess. So again, or not necessarily a bite, they're interactions. So simple things like this. I had a kid who came in and was obsessed with my clock. So we made a clock, and it was great because we can use it where I could put things around the clock, and we have to go around. We also use an around the plate method with some kids. But this week I said, okay, how many licks should we take? And he hit 12. I'm like, great, we'll do 12 licks. And he made that face, but he kept going till he got to all 12, and that was really awesome. So really looking at what these reinforcers is, what these kids are interested in, and making that feeding session more fun. You know, I had shown the comparison chart. We also just have, you know, the one, let's put our food in the middle and talk about it. And then our basic first next mat. Well, first we're going to do this, and then we'll do that. Whatever you choose to put in. So those are just a few of the little extra things that I had to show.
Hey, everybody. Can I just jump in? I'm a feeding therapist in Boston, and thank you so much for this. Karen, I just wanted to jump in and say I agree with what Susan and Kate were saying about the going really slow. I had a kiddo who came to therapy and was afraid to eat even his own foods from home if I was in the room, right? So first I would go out in the hallway and he'd sneak his snacks. And then, you know, if I got up to wash my hands in the same room, he'd sneak one of his goldfish while I wasn't looking. And eventually, after several sessions where he understood he didn't have to eat if he didn't want to, he chose to eat maybe when I was looking. I just think that for kids where you know he knows how to eat, I would really look at that pressure side of things too, and see if maybe it's just that anxiety around being asked to eat so often that's slowing him down.
No, that's really great advice. No, thank you so much. This is really all very helpful.
I want to ask Aurelie, do you want to come on and ask some questions?
Hi, I wondered if you guys could give me a little advice. Nicholas is almost 2 years old, and he's a little behind from where your kids are. He doesn't swallow at all. So I think we're taking the right approach. I mean, we're exploring everything available, but I'm so sorry. But I wonder if you have some idea or any suggestion. We're trying some electrical therapy over here, simulation. We're trying oral massage. We're trying also helping him to support his head and trunk, like physiotherapy and all that. I'm thinking about buying a Theratug, which is a suit that helps him gain support. I saw it recommended by in a book that I just read from a Canadian neonatologist, and I think that's, I mean, we're taking everything we find. We're trying to help him, but his first problem is that he doesn't swallow properly, and he keeps getting respiratory problems, like many pneumonias and stuff. So I know you guys are, your conference is about the experience of feeding, but do you have any advice for us, like for the ones who are just starting to get near that? I'm sorry.
Oh, really?
Full
Does he
time.
does he manage his own saliva okay?
Yes, he does. Most of the time, sometimes he just gets tired and you can hear like the coffee machine here like this. But then he finally gets it. But we think some of that goes to his lungs sometimes because he
He's
gets
aspirating.
Mhm. But he's better. Like when he was born, he had none reaction to swallowing, and now he manages better, and I don't have to aspirate it anymore. Like I can spend a day just. We also give him respiratory pulmonary therapy, like vibrate him, make him cough, and throw his mucus out by vibrating him with my hand.
Mhm.
So that's everything that I have found here in Mexico. We're in Mexico, but I've been looking. I thank you for the website that you suggested for the dysphagia association and all that. I think I'm gonna find more information, but Nicholas is far behind from that. I think he has to get better, and maybe there's something that I'm not doing that you can suggest.
Will he do non-nutritive sucking with a pacifier?
Yes, he's starting to suck it more.
You know, and sometimes chilling gives that increased sensory awareness. Chilling,
Chilling the pacifier.
dipping and chilling.
Okay.
Kate, do you have any suggestions there?
Thank you so much for sharing your story. It sounds like you are working so hard and doing so much. So such a testament to your son. I also am excited that you're looking at his positioning while he's eating and still working on his head and trunk control, because I truly believe those foundations are going to help support what he does in and around his mouth. So does he have the opportunity right now? Are you working with any motor therapists down in Mexico?
Yes, we have a motor therapist. Mm-hmm.
And what about when he eats? Where does he like to sit for his food? Does he sit, is he held in your arms? Does he sit in a high chair?
We sit him in a high chair, well, in like for the car seat.
Car seat?
We sit him in a car seat for some feedings.
Mm-hmm.
Some I do him on my lap.
Mm-hmm.
And some others like with some pillows behind. But he doesn't like the car seat. He hates it. He doesn't like to sit that much yet. Also,
Yeah.
because he can do it. So he tries to. Yeah, he tries to swallow by going like this back.
Lean his head back.
Right, and
Yeah.
that we really want to make sure we can support that nice little chin tuck head to protect that airway. Is he getting G-tube fits or is he getting oral
Yes.
feeds?
Yes, he has a G2 since he was out from the NICU and ICU.
Really, this is Dr. Musuino. I also speak Spanish, so we can take this one offline if it's more comfortable and it can answer more of your questions. I can send you my email directly and we can connect aside
Thank
from
you.
the webinar, because it sounds like you are working with a lot of things and there's a lot going on. I am hearing that your son has been in the hospital for quite some time. Is that correct?
Yes, he has been in and out.
And when he was a baby, did he require a breathing tube, intubation when he was a baby?
Yes, for
how
7
long?
days.
For
7 days. Mm-hmm.
And from there on, the swallowing has been always a challenge. He's been aspirating, and that's why they decided to be safe, to be able to provide nutrition with the G-tube. Is that correct?
Yes.
And I'm also hearing from the descriptions that you're giving that he has very little control of his trunk, and when he activates, he gets really stiff, like kind of spastic a little bit.
Sometimes, but we found out it's not the spasticity. His spasticity is better now. It's helping him, but sometimes it's the thing is he when he's eating, he doesn't like to be sitting. I don't know.
Yeah.
Sometimes he wants to stand. He's gaining support to stand, and he likes to stand. And sometimes I feel him standing up, and he's better.
Yeah. And then in terms of the way that he communicates with you, how does he communicate his needs to you when he wants to play, when he wants to change position, when
he doesn't do that much? He doesn't
kind
communicate.
Yeah.
He expresses like discomfort with his face, and he fights you when you're trying to feed him, sometimes a little bit, like he tries to pull his tube, or he tries to grab it. And
do you know where the strokes were in his brain, or where are the injuries?
Well, I don't know him by memory right now. I have the old information.
Do you know if they were both sides or one side? Do you remember?
It was mostly on the left side.
Okay, so these are things that's what I'm offering. Like, we get in contact and we can maybe talk offline, and so I can see if I can help a little bit more concretely. But there are probably a lot of things that he is working with, and sometimes we do have to take a little bit of a very, as you're doing, a very gentle approach. But what I'm trying to say is, do not despair. And there are so many other things, as Susan was referring to, those kind of milestones. We don't want to see them as the stuck thing with an age that they need to happen. We want to see them as a reference of that curve that needs to happen from A to C. You need to go through B. And that's what we are trying to, and I think Kate and Susanna are asking questions too, because there's a process that he's working on. Supporting that process. Don't get too anxious about what he's not doing. Work on what he's doing to get him to the next, and that will slowly make things possible for him. I was saying it with a lot of experience, having seen the opposite, trying to make him match or do something he's supposed to be doing by chronological age, but disadvantaging the child because they are not ready yet to be working on that. And then they get a really bad experience, or they get aspirations and pneumonias, or they associate feeding with a really torture kind of moment and stressfulness. So there might be a dephase here between what he needs to be at to be able to experiment. And still a lot of very good advice of not trying to put something to support that head so that doesn't happen if he has anything in the mouth, and being very gentle in the way that you guys are introducing things through the mouth. Kids that have had any type of experience with intubation, and not all of them have it, will also have something which is not only the sensory deficit, but aversion to things going to the mouth. Because the first experiences of their mouth were not their pleasurable experiences that a baby can have if it's experiencing a bottle, a hand, or a nipple, okay? So we have to also think about, maybe this is something that he will tell us when we can go closer to it. Kate and Susanna, I don't know if there is anything else that you want to tell Areli. Areli, I'm gonna send you my contact information.
The
Thank you
other
so much.
thing that I think I just like to mention is, I feel that feeding is such a multi-sensory experience, right? And I think if your son is not quite ready to accept a lot of these tastes in his mouth, it doesn't mean we still can't give him some of those sensory experiences of how textures feel on his hands, how textures feel, even to do you could work with your therapist on some oral motor activities around his face, and how to have those positive experiences that Dr. Mussolino was speaking of. And thinking about, when we think about touch, temperatures, and even smells of food and the cooking in your home, those are all going to help build a story and be some building blocks too for moving forward.
Yes, thank you so much. Yes, I'll work harder on those too. Sometimes we like get some orange and orange peel, and then put it around his nose and on his arms and tell him what it is, stuff like that. But that needs to be a routine, so he can experience like in the other conference that you said you have to tweak his environment. You had to get everything close to make him experience everything.
And it might be that there are multiple sensory challenges here. Even the vision may be one of them. And that's what I'm saying. It sounds like what I do here is that you're experimenting a lot. You're trying things. You're looking for resources and stuff like that. What I want you to focus just to guide, is it right or not, is what you see on him. If he's in a good place, having a pleasurable or a calm experience, keep going with that. It's the right direction. You get those hints. Oh, this is good. But if he's really, and a lot of these stimulations that we do externally may be overwhelming to him. So watch out and be there for him as you are, looking at what is his response to all of these things that you're trying. I'm saying, keep trying, keep asking. You heard Tricia. There are things that may not be rightly indicated because it might work for one kid, not for another one. The only people that can tell these guys is you, the parent. Like, you know the kid the best. So if you focus on the experience he's having and keep trying things and doing experiments with playfulness, you are in the right track and you're not going to hurt him. Okay. And I think, again, food is the anecdote here because he has the G2 and he will continue to be fed and nourished and grow. So everything that goes to the mouth should be a pleasurable and awesome way to try something, even if it's not food. And it can be anything that is not necessarily a risk for him to aspirate or choke, no? Like,
Yes.
so those are the things that I can say without knowing the case and having had examined him or anything. And all of us are trying to provide that knowledge to you guys to start judging and assessing what you're seeing in the kid, what you're hearing, how to look for the resources and apply them as you go.
So I just want to give, Kate has to sign off in a minute, but do you want to say just a sentence or two about what's coming next month on November 19th? And then I think we'll have Patty close out the session.
Or we'll do a quick preview. So I'm super excited to come back and be able to speak with this group next month in November. The topic there is really going to be to elaborate more on sensory experiences and how that influences meal times and how deep those go. You know, we can talk about how that impacts our children to get to the table and where they're sitting and the foods they like, the foods they don't like, and how we identify the difference between picky eating habits and resistive eating habits, and when it starts to be a problem that you might want to get another feeding therapist involved in. So we'll be talking more about that in November and looking forward to seeing you guys again.
And I want to thank again, Tricia, for like putting yourself out there to share your story. I have to say there's nothing we can say from the medical community that touches and makes more sense than hearing what really takes to go through the challenges and the development, just the journey. This to me is helpful for anyone to parent the stroke driver and the non-stroke drivers. So I take tips from all of this, always for all the patients and all the people that I know. And I wanted to thank very especially Suzanne and Kate. I know how tight and how busy you guys are with your schedule clinically. I know how difficult it is to take an hour and a half in the middle of the day. And we've done now this for several times in preparations for these webinars. So from the bottom of our hearts, the Parent Advisory Board and Brian and myself, thank you for doing this. And thank you everybody for joining and for asking your questions, for sharing your stories. Thank you so much for coming on video too. I think it's also very meaningful. And please take advantage of the chat to form community. You can see people that may have kids of your same age, same questions. We leave it open so you guys can also create that network for yourself. Again, I would close with saying we look forward to seeing you in November. And remember, you are the expert. You now just have to assemble your team of consultants. So thank you. And I look forward to seeing you all and Kate, your talk in a month from now. We'll say goodbye.